Hello everyone, my name is Joseph Salazar and I am presenting my qualitative research project for the requirement of ATRN 8210 qualitative research methodology at AT Still University. Proper hydration is an important component in sports participation to achieve optimal performance by athletes, and professional baseball players are no exception. Proper hydration plays a significant role in performance of athletes. Dehydration is therefore defined as a dynamic loss of body water or the transition from eurohydration to hyperhydration. Eurohydration is defined as normal body water content versus hypohydration is a body water deficit. Water loss equivalent to 2% or more body mass appears to reduce endurance exercise performance in both temperature and hot environments, especially when the duration of exercise is around 90 minutes or more, according to the literature. Professional baseball players have the resources to consult with the team's medical staff of athletic trainers, strength and conditioning coaches, physical therapists, and sports performance coaches on the proper ways to hydrate before the games. Hydration strategies have been drilled into these players by members of the medical staff, yet they still experience hydration deficits. If players agree that hydration increases performance and assists in the prevention of soft tissue injuries, then why are some players still not utilizing their staff for hydration strategies? The purpose of this paper is that professional baseball players have the resources to consult with the team's medical staff and the tools to properly hydrate before the games, yet some still have hydration deficits. The purpose of the study also is to identify how professional baseball players approach hydration before in games and if they utilize members of the sports medicine team. Therefore, my research question is, what are professional baseball players' perception about properly hydrating before games with the interactions of athletic trainers? With this research question, I chose phenomenology for the study of research tradition. The focus of phenomenology revolves around how people experience and how it draws meanings from their worlds. In other words, is how the participants experience a specific phenomena. For this research study, it allows professional baseball players to offer their own thoughts and perceived notions about how well they feel they hydrate before games through their interactions with the athletic trainer. For my sampling methods, I chose criteria sampling because of the specific needs for the research to determine a set of criteria for selecting the participants. My selection criteria included had to be male and to be a professional baseball player, have at least 2 years of Major League Baseball experience, 5 years of total experience, including both minor league and major league. During that criteria selection, I chose 3 players, 1 pitcher, and 2 position players. Now, ideally, I would have liked to use about half the players of a 25-man roster, as well as even diversitize my participants in this study. I felt that having a more diverse participation pool, including Latin players, would have been ideal since about 40% of the team's roster players constitute Latin players. During my data collection, I had both a interview as well as observation for my data collection. On the interview, I had 7 semi-structured interview questions, along with some probing questions along the way, depending on how they answer the questions. Players provided fake names for confidentiality reasons. They also signed a consent form that they were wanted to be included in the study, and that they're doing this on their own free will. They were asked that the recording would stop at any time they felt uncomfortable during the interview. The interview was recorded digitally and then transcribed for trustworthiness. During transcribing the interview, we did code them and theme them. During the coding and theme process, I came up with 5 themes that came out of the interview. Those were experience, performance, routines, communication, and barriers, as well as subdomain categories. During the experience theme. It included both their minor and major league experiences, their hydration strategies during their minor league and major league careers, as well as their experience in their athletic trainer staff. Under performance, it came with the recovery. That recovery played an important aspect of hydration strategies, as well as their injury prevention. Routine was defined in all three of the gentlemen. That it included their pregame, their game routine, as well as what they did after the game. Communication seemed to be a valuable component in their hydration strategies on a daily basis, as well how well they communicated with their athletic trainer, their communication as terms of the availability of the athletic trainer as well as the players, the communication as to how the players individualize their pregame strategy or their hydration strategy overall. One of the questions was, what are the perceptions as to why players did not consult with an athletic trainer about hydration strategy? And then a couple of barriers came out of that. Was the lack of experience of hydration strategies for the player. Players also mentioned that it was not as important to them as to why they wouldn't consult an athletic trainer. Trust was an issue with the player, and stubbornness as to why they would not consult with an athletic trainer as opposed to their hydration strategies, which I found to be quite interesting. During the data collection of the observation portion of the study, the observation took place in the athletic training room during the off-season at Progressive Field in Cleveland, Ohio. There were 5 total players who were being observed. I was 2 pitchers, 2 position players, and 1 catcher, along with 3 members of the athletic training staff. The field notes were then divided into players who showed hydrated, or who showed they were being hydrated, as well as those players that were observed and were not hydrating. Similar patterns were observed during the observation process as the interview domain showed under the experience, performance, routine, communication, and then barriers as well. All those 5 domains were presented also during the observations process of the data collection. The occurrence of chance for me was that it was done in the off season because the observation was done during the off season. We only had 5 players in the athletic training room during that time. It would have been different if I would have done this observation during the season, where we would have had multiple players as well as the diverse players come in during the course of the season as opposed to the off season. From the result standpoint, under the experience, one of the players mentioned that they rely heavily on their athletic trainers. It gives them a chance, or it's a give and take. You feed them the information and they give you the results, and they are here to help me as well. Another player mentioned that the trainers really keep on top of everything and make sure we know what's expected of us, where we go when we go out there, and what we should be taken in. So experience with your athletic trainer was voiced on those quotes. To one player, hydration is one of the biggest important things for me personally as an everyday player, is to reduce muscle cramps and also muscle fatigue, and especially muscle strains. So performance was important to this individual. In regard to routines, all 3 players indicated their specific routines, what they go through in an everyday process before the game, what they do during the game, as well as how well they hydrate after the game. So routine-oriented routines was very important to these individuals. When it came to communication, player felt like the more they rely on the athletic trainer, the more communication that you'll have, the better off you're going to be. Some of the barriers when it came to asking the question as to why they felt players would not consult with an athletic trainer about their hydration strategies. Some of the barriers were the better relationship you have with an athletic trainer, the more trust they would have with them. So trust was an issue, and then the more likely that they would believe the athletic trainer. So trustworthiness was also incorporated with trust. At the same time, at this level, one reason why you wouldn't use your athletic trainers because you are stubborn or not knowing. Not knowing is when you are young and you start out in the profession, in the professional sport, and no one really educates them on hydration. So the not knowing as well as the stubbornness came out as a result as to barriers of why they would not consult their athletic trainer regarding their proper hydration strategies. When it came to the trustworthiness of this paper, um, I would have gone with multiple analysis triangulation as well as peer debriefing. Um, Under the multiple analysis triangulation, I felt that having different researchers conduct and separate analysis and then compare and contrast the coding, I think would have been very beneficial. The would assist in the transcript without showing researcher bias. I know that during the process of the coding for me was very difficult. The peer debriefing, having someone with more advanced knowledge in qualitative research would have been show the validity of the study. This would increase the credibility of the study as well. Overall, my reflection on this paper, it definitely was not easy as I would have thought. This is my first exposure to doing a qualitative research study. It was definitely time consuming during the interviewing as well as coding it and coming with the results. I learned a ton during this process. I definitely have a better understanding and appreciation of qualitative research methodology. I feel like I have a better grasp of the concept now as opposed to the first week of class when they asked us what we thought what qualitative research was. Some of the challenges I mentioned already is the interview and coding, the observation was difficult, and the results and how to come up with those. And trying to be unbiased was one of the hardest things to do, as we all have seen. One of the positive comments of this study or this process was the opportunity to finally see a different research approach on how to do this. And I think this is very valuable. I was very fortunate and glad I got to do this and take this class and see the difference between those two. So I appreciate you all listening to my my presentation, and I look forward to your comments. Thank you.